Do much.
Okay, now we are talking about the pediatric first part. Pediatric has the most amount of questions out of all the topics, like it's almost 500. So we're gonna try to take it slowly. Hopefully, we'll be done with it one day. Now, yeah, we'll be done with it. No, not just one day. Okay. Now, now, if you are just a second. Okay, if you are a 1-year-old boy who have a CD19 low and CD3 is absent, how can I treat you? And immunoglobulin level are low.
CD19 low.
Mm,
Uh-huh.
yeah, CD3
C.
absent.
Okay. And immunoglobulin low.
Oh, yeah.
IVIG.
No, so this one, when I tell you CD19 low, and that means no B cell. When I
Mm-hmm.
tell you CD3 low, absent, that means there is no T
Oh,
cell.
SCID.
Yeah, that's a SCID,
So
gene
SCID.
defect due to failure of T
Bone
cell
marrow transplant.
development, and failure of T cell development lead to B cell dysfunction. Inheritance is X-linked recessive or autosomal recessive. Clinical features were recurrent severe viral, fungal, opportunistic pneumocystic infections, failure to thrive, chronic diarrhea, and stem cell transplant. The treatment is for it, okay?
Okay.
Now, this is good. So this immune is very important. You're gonna need it in step 2 and step 3. So those questions, it's immune, pediatric immunology. It's a very important topic. Okay, let's go to the next one. Now, imagine you are a 2-year-old boy with a boil on your right arm. Okay, there's no improvement with antibiotics. So I did culture. I found Staph aureus.
Mm-hmm.
Okay, at 7 months of age, you had left inguinal lymphadenitis due to Serratia marescens.
Mm-hmm.
Okay, and 2 months ago, you had fluctuant mass on the lateral arm. So what the hell is going on?
Chronic glomerulomatous disease, CGD.
Yeah, chronic granulomatous disease is majority X-linked recessive, can cause recurrent and cutaneous infections in catalase positive organisms. Which one are catalase positive?
So that would be the need places, nocardia, staph, aureus, strep, listeria, serratia, all of those.
Staph,
Mm-hmm.
Serratia,
Mm-hmm.
Burkholderia, and Aspergillus.
Mm-hmm.
Yeah. Strip, you said strip. Strip, I don't think it's a gram
No, I
positive.
didn't say strep. I said staph, serratia.
Yeah,
Mine
Staph,
says it's
Serratia,
nocardia.
Nocardia, yeah, Nocardia.
Mm-hmm.
Okay, so the diagnosis, we use neutrophil function testing, which is dihydrorhodamine 123 test, and nitro blue tetrazolium test.
Mm-hmm. Mm-hmm.
Okay, now if you're a 5-month-old boy who had an episode of otitis media and gastroenteritis due to rotavirus, okay, when I examine you, the tympanic membrane is poorly mobile. Okay, so that's not important, like that's generic, but the one that gives it away is that lymphocyte CD4 count is low and CD8 count is low, and the total lymphocyte and the immunoglobulin level is low. What's your diagnosis?
So this also will be so you have virus going on, you have bacteria going on too. So I think it's also SCID.
Yeah, good job. If the parents refuse immunization, just document the risk and benefit and stuff. It's not an important question. Okay, now this is a very tough topic like pediatric cardiology. It's an interesting topic. So if
I
you're
like the way you
uh,
announced it.
yeah, yeah, it's like kind of one of the hardest topics for me, like the pediatric cardiology. I still mess up some of the like the tricuspid atresia and these things.
Hmm. Hmm.
Yeah, like you needs a lot of review. So 14-year-old, if you're a 14-year-old girl with leg muscle fatigability while like climbing stairs, and you have a
Leg
Turner's,
muscle fatigability and what?
so you have leg muscle fatigue while climbing stairs, okay, and
Hmm.
you have Turner syndrome, and on when I do auscultation, I find mild continuous murmur heard all over the chest. So what is your diagnosis here?
Coarctation of aorta.
Yeah, coordination of aorta, rib notching. Now, if you're a 25-year-old male who 25-year-old mother who
I
delivered
was like, Mel.
no male mother who delivered the baby with rocker bottom feet and overlapping
Hmm.
fingers.
Hmm.
So
Edward,
what heart
trisomy 18.
what
Hmm.
heart condition associated with that?
Heart condition, Edward. Is it not what do you call it? Um those what do you call it? Ventricular atrial whatever cushion defect. Those ones, right?
Ventricular septal defect. Yeah. Now, easy one. 22-month-old boy with hollow systolic murmur. What is that?
VSD.
Yeah, that's a VSD. Now, if you're an 8-year-old girl
Hmm.
with injected lips and pharynx, bilateral conjunctival injection, and blanching erythematous rash across the face, trunk, extremities.
Kawasaki disease.
Yeah, so what are the diagnostic criteria for Kawasaki?
Diagnostic criteria.
Mm.
Oh wow. What I know is, the features crash and burn.
Hmm?
I say what I know is the features, what you can see. I don't the okay, the one that I know, the fever is gonna be greater than 5 days.
Yeah, that's a good one. And more than four of the following, which is eye injection, mouth injection, lymphadenopathy, and skin rash, and edema. That's it, simple. Treat aspirin, IV immunoglobulin. Complication can have aneurysm or MI. So MI in kids could cause.
Hmm.
So, it's crazy. Now, if you're a 3-day old girl with poor feeding and decreased urine output, okay,
Or feeding 3-year-old girl.
yeah, yeah,
Okay.
with poor feeding, decreased urine
Hmm.
output. So when I examine you, oxygen saturation is 96% in the right foot and 85%. Uh, Oxygen in the right hand is 96%, but in the right foot is 85%. So what's your diagnosis?
Right foot 80. PDA
This is,
or
and they have
ho
systolic murmur heard at the
hmm
left paravertebral interscapular area.
paraventricular, poor feeding, 3-year-old, oxygen saturation, right foot. Is that what you said?
Mm. This is
And
coarctation
85%.
of aorta.
Okay.
There is imbalance in the oxygen. That's what give it away. Oxygen saturation in the right arm
Hmm.
90, while in the left 80. While in the right, sorry, right foot is 80. Okay, that's what give it away.
Okay, one
Okay,
second. I'm trying to fix my microphone.
okay.
Sorry, my microphone went off. Okay, coarctation of aorta. Okay.
Yeah, clinical feature, you have hypertension in upper extremities, decreased perfusion to lower extremities. That's why you'll have decreased postductal oxygen saturation, decreased femoral pulses, lower extremity claudication,
Mm-hmm.
and can present with heart failure as irritability, poor feeding, diaphoresis, cardiogenic shock in infants, and palpable pulsation of intercostal and vessel in adults. How do you treat it?
Coarctation of aorta
Surgery.
surgery. Yep.
If you are a 2-month old boy,
Mm-hmm.
okay, that turned blue for several minutes during feeding, okay, and the knee chest position help you decrease the crescendo decrescendo ejection murmur and cyanosis.
Mm-hmm.
What is that?
Tetralogy of Fallot.
Yeah, this tetralogy of fat and this knee chest position increase vascular resistance, systemic vascular resistance. That's why it helps.
Mm-hmm.
What are the EKG features of hypertrophic cardiomyopathy?
So it will be a systolic murmur.
EKG.
Um, oh, EKG of
There is something called Cornell criteria, which is left ventricular hypertrophy, tall R wave in AVL, and deep
mhm,
S wave in V3. Okay, and there's repolarization changes
okay.
in one AVL, V4, V6. Now, if you are a newborn girl with micrognathia and absent-thymus, what electrolyte abnormality should I expect?
Hypocalcemia.
Yeah, good job. This is what chromosome?
Discharge. Chromosome 22.
22, Q11,
11p. Mm-hmm.
Q11.2. Defective pharyngeal development. They call it
Pharyngeal,
catch.
pharyngeal pouches. Yeah. Catch 22.
Yeah, conotruncal cardiac defect, abnormal facies, thymic aplasia, cleft palate, and hypocalcemia. Now, if you're a 6-month-old male with a murmur at the left sternal border, continuous murmur, what is that?
Murmur.
Yeah, systolic diastolic murmur, what is that?
Systolic, diastolic murmur.
Yeah.
Like a holosystolic murmur.
I don't call it holosystolic's only in systolic. This is
Mm-hmm.
called continuous flow murmur. Like in systolic and
Oh, PDA.
PDA, yeah. If you're a 6-week-old boy with round dysmorphic face, with upslanting palpebral fissure,
Mm-hmm.
furrowed tongue, and abnormal palmar crease, and systolic murmur, what's your diagnosis?
Um, Down syndrome.
Yeah, it's down with VSD. Yeah. Now, if you are a 15-year-old boy who collapses suddenly while playing basketball with his friends,
Mm-hmm.
yeah, what's your diagnosis?
How come?
Yeah, how come? Major causes of sudden cardiac death: four things: coronary artery disease, cardiomyopathy, for example, how come? Arrhythmia, like long QT, and
Mm-hmm.
congenital heart disease. Those are four
Mm-hmm.
things. Keep in mind.
Okay.
Now, if you're a 9-year-old boy with oozing skin lesion on your legs, when I examine you, I find scattered erythema overlying vesicle in a linear arrangement below the knees. What is that? What's your diagnosis?
Linear arrangement will be like a contact dermatitis.
Yeah, contact dermatitis type 4 hypersensitivity reaction.
Mm-hmm.
It's a T cell and macrophage mediated. Same as tuberculin skin test, same thing.
Mhm.
While lupus, PSG, and serum sickness, that's a type 3. Autoimmune
Mhm.
hemolytic anemia and ghost pasture, type 2.
Mhm.
Anaphylaxis urticaria, that's a type 1.
Mhm.
Just something to keep in mind. Now, if you're a 3-year-old girl, when I examined you, I found third degree burn to the back, buttocks, and legs. Okay, and there's a sparing of the flexor surfaces.
Mhm.
What's diagnosis?
Child abuse,
Yeah,
dipping in the water.
yeah, that's terrible.
Mhm.
Like I don't believe that a human being can do that.
I know, that's crazy.
Yeah. Now, if you're a 6-year-old boy, okay, brought to the physician because of inattentiveness, and you
Mhm.
have limited language skills compared to your peers. So, what do you think is causing that?
So limited language, it can be autism,
It's most
or
common
it can be
undetected hearing impairment.
okay, undetected hearing impairment. I
Yeah,
guess you
'cause-
start with that testing first before you can,
yeah,
you know. Okay. All right.
yeah, poor kid. Okay, if you're a 14-year-old boy with a mass on your right nipple on Tanner 3, you has normal Tanner 3 external genitalia and testicular volume is 14, which is normal. Okay, so how can I treat you?
Reassurance.
Wow, smart, good job. Yeah, so common
Mhm.
causes of gynecomastia. There
Mhm.
is increased estrogen production or peripheral conversion. For example, testicular, adrenal, human chorionic gonadotropin tumor,
Mhm.
cirrhosis, thyrotoxicosis, congenital excessive aromatase activity, androgen use, like drugs like spironolactone, cimetidine, herbal product like tea tree oil, lavender oil. So those increase estrogen. And
Mhm.
that other causes like androgen deficiency. For example, hyperprolactinemia, renal failure, Klinefelter syndrome, and testicular
Mhm.
damage.
Mhm.
I'm trying to think which one. I have a friend who had gynecomastia. I'm trying to think which one of them causing that.
How old are you, if I may ask? I
Oh,
know you're
me?
young. Uh-huh.
Me? Guess how.
Yeah, I haven't seen your face really, so I can't.
So, if you are a 7-year-old girl with
Mhm.
axillary and you have development of axillary and pubic hair, can you imagine? Like 3-year-old.
That would be scary.
Yeah, TFSH elevated. So what is causing that?
FSH is elevated, so that might likely be like a tumor. FSH is elevated, yeah.
This is central
What do you
precocious
call it?
puberty,
Yeah, central.
early activation of
Yeah, which would be like a tumor, in the brain or something. Yeah.
yeah, early activation
Mm-hmm.
of the hypothalamic pituitary ovarian X. Now, if
Right.
you're a 14-year-old girl with irregular menstrual periods,
Irregular.
yeah,
Mm-hmm.
and when I administer micronized oral progesterone, result in withdrawal bleeding in 3 days. So, what explain the irregular periods?
Is because of immature HP, whatever it has this, like, the whatever is not matured yet. She's still, you know, I don't know.
Yeah, it's insufficient gonadotropin secretion.
Mm-hmm. Yeah, it's
Okay.
not matured yet. Yeah.
Yeah, it's not mature. Immaturity is the cause for irregular cycles in women shortly after menarche.
Mm-hmm.
Now, if you're 7-year-old girl with a pubic hair development again and breast enlargement, when I examined you, I found right ovarian mass and increased estrogen. What is causing that?
Granulosa cell tumor.
Granulosa cell tumor, yeah.
I hope my exam will be like this. Oh my goodness, I'll be so happy.
Yeah, it's gonna be similar like this. You're gonna do great, yeah.
I'll be so happy. I just want to get this thing over with.
Yeah, yeah, you will, you work so
I've
hard.
not done anything. I've not, started my letter. I've not started. When do they start that token something that
What?
you have to get a token? It's next month, right?
Yeah, it's in June, yeah, I think in June, yeah.
Okay. But anybody can get it anytime, right?
Yeah, anytime, yeah, that doesn't matter.
Okay. Yeah.
Now, if you're a 16-year-old girl with painless, heavy vaginal bleeding for 3 days, and your menses are irregular since menarche of 14. Now, on exam, you have a moderate amount of blood in the vaginal vault and active bleeding through cervical os. Hemoglobin is 9.8, so how can I treat you?
Hemoglobin is 9.8
Mm,
and she's bleeding.
mm.
I guess she doesn't need transfusions. Maybe you can put her on OCP.
And give her high dose estrogen. So, the
Mm-hmm.
medical management for acute abnormal uterine bleeding is that first you give them IV and high dose IV or oral estrogen,
Mm-hmm.
and then maybe you can add high dose combined oral contraceptive pills, or
Mm-hmm.
you can give them high dose progestin pill, or you can give them tranexamic acid.
Okay.
Those
So estrogen, OCP, progesterone, or the other one. Okay.
yeah. Now, if you're a 13-year-old girl
Mm-hmm.
who have a crypto orchid gonads with no
Girl,
uterus, huh?
you say girl,
Yeah. So what's
crypto,
yeah? So what? How can I treat you?
crypto what?
Crypto orchid gonads and no
So
uterus,
that would be any hair. That would be AIS.
no hair. Yeah. So you do gonadectomy after
Mm-hmm.
puberty.
Right.
Yeah. So for
Gonadectomy.
yeah. So this is an interesting case. So if you have a this one they have a it's an X-linked mutation of androgen receptor. So it's interesting.
Which one?
This androgen sensitivity
Oh, okay.
it's
Mm-hmm.
X-linked. They have absent uterus and upper vagina and cryptorchidistis.
Mm-hmm.
No hair, axillary,
Right.
XY. How about if you have hypoplastic or absent Mullerian system, absent or rudimentary uterus, upper vagina, normal ovaries?
Mm-hmm.
What is that? What do you call it?
Anti-Mullerian.
Yeah, Mullerian agenesis. How about if you
Mm-hmm.
have malformation of urogenital sinus and Mullerian duct, and you have everything normal except abnormal vagina? This is transverse vaginal septum.
Okay.
If you have complete or partial absence of X chromosome and normal uterus with streak ovaries, what is that?
Um, what do you call it? Turner syndrome.
Term. Now, if you're a 16-year-old boy with diarrhea, rash, beefy tongue, and poor concentration,
Um, Pellegriniacin. Yeah, deficiency, vitamin B3. Whichever one you want to pick.
yeah, good job. Now, if you're an 18-year-old woman who has been breastfeeding exclusively,
Mm-hmm.
okay,
Mm-hmm.
oh, sorry. So, you came to the pediatrician with your 3-year-old daughter for the first time questioning breastfeeding. So you've been
3-year-old daughter.
yeah, 3 day old daughter.
Oh, 3 day old. I was like 3 year old.
No, 3 day, 3.
3 days old. Okay, sure.
Yeah, the girl says that it's painful breastfeeding and believes that she's not producing enough milk.
Mm-hmm.
Okay, so what's the benefit of breastfeeding?
Hmm. Benefits of breastfeeding, of course, they say that it helps with fighting infections, the mom's maternal antibodies is going to be in the system to help all those things. It helps with, things like allergies and asthmas, like robust immune immunity. It also, yeah, it helps the mom for the uterus to contract, back to normal.
Yeah,
And
rapid uterine involution and decreased
mhm,
postpartum bleeding,
right.
the faster return to prepartum weight,
Hmm.
improved
Hmm.
child spacing, improved maternal infant bonding, and reduced risk of breast or ovarian cancer.
Yeah, it's good to
Yeah,
breastfeed.
yeah, good.
Put,
It's very good.
puts you back in shape.
Yeah, yeah, good for. So, but
Tell your wife when you marry.
I should. Yeah, the infant benefit improve immunity, improve GI
Mm,
function, and
okay.
prevent infection like otitis media,
Hmm.
gastroenteritis, respiratory illness, urinary tract infection, decreased risk of childhood cancer, type
Hmm.
1 diabetes, and necrotizing enterocolitis.
Okay.
Contraindication to breastfeeding like herpes, HIV, TB, varicella, some medications like chemotherapy and stuff like that, drug abuse, galactosemia. Okay, those sort of things.
Hmm.
Now, if you're a 4-month-old boy with hypoglycemia, poor feeding, enlarged tongue, and umbilical hernia, your right upper and lower extremities are significantly larger in circumference than the left extremities. So,
Hmm.
what's next step in management?
So diagnosis first it will be Beckwith, Wiedemann syndrome, and I think they said you have to do ultrasound every 3 months or 6 months until 4 years. And then 4 to 8 years, now you can do ultrasound again. And then there is one other thing you do. Hold on. Ultrasound and something else that you do
Yeah,
also.
yeah, you do ultrasound 4 to 8 years, and you do abdominal ultrasound, renal ultrasound from 8 to
Mm-hmm.
adolescent,
Mm-hmm. And
ultrasound and alpha fetoprotein every 3 months.
yes, alpha fetoprotein.
From
Mhm.
birth, so from birth to 4 years, ultrasound and alpha fetoprotein. Four
Okay.
years to 8 years, abdominal ultrasound. 8 years to
Mm-hmm.
adolescent, renal ultrasound. Yeah, so it causes microsomia due on falacel microglossia,
Mm-hmm.
hemihyperplasia. Complication can be complicated to Wilms tumor, hepatoblastoma. That's why we need surveillance, alpha fetoprotein, abdominal ultrasound.
Mm-hmm.
Abdominal ultrasound. What chromosome?
11, is it? Or yeah, 11, yeah.
Deregulation of imprinted gene expression in chromosome 11p15.
Hmm.
Now, if you're a 2-year-old boy with a maroon colored stool, okay,
How old?
2-year-old with maroon colored
Oh, okay.
stool, 2%
Mm-hmm.
prevalence,
Mm-hmm.
2 to 1 male to female, 2% asymptomatic at age 2, located within 2 feet of ileocecal valve.
Mm-hmm.
Okay.
Mecos.
Yeah, so we check that, we do technetium 99
Mm-hmm.
per technetate scan.
Technetium. Snack. Scan.
Uh,
Scan.
Technitate, yeah. Present with asymptomatic incidental finding, could be painless hematochezia, and can
Hmm.
cause intussusception, obstruction, valvulus. How do you treat it though?
How do you treat this?
Mm,
Is a ectopic foci, so I guess you have to remove it.
yeah, surgery if it's symptomatic, causing a problem. Anything causing a
Mm.
problem, we just take it out. Okay, now if you're 3 year old boy with a scaly skin follicular hyperkeratosis, what vitamin is that?
Follicular hyperkeratosis, vitamin C.
A deficiency.
Oh yeah, 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 yeah.
Yeah, I
Follicular,
can make it.
follicular. Hey,
Yeah, you would have known it if I told you that he's having difficulty adapting to darkness and dry
right,
eyes,
yeah. Nine blindness, yeah.
bite out
I
spots.
was thinking about that follicular something, the for vitamin C, the hair, and it has also follicular something, yeah.
Yeah, yeah,
That's
you're
right.
right. Yeah, maybe I didn't. Okay, so this question is a very it's an annoying question, I know. So, what
Oh
are the
my.
development milestone?
Oh my goodness, don't ask me that.
Really?
Are you gonna ask me or just throw something to me for me to tell you? Okay, the ones that I know is if they're at 9 months, they should be able to do like a pincing, grasping, whatever with their finger. Okay. At 2, they should be able to, I think, draw a line. 3, they're supposed to draw a triangle. At 4, they're supposed to draw a rectangle. Um, yeah, then, at 2, 2 words, at 3, 3 words, and things like that. But, if you give me like a little something more, I can tell you. Don't tell me because you're telling me to go memorize it. I am not memorizing it. But I can tell the difference when do you know it yourself offhand?
Mm. No, I just know some of them. Like it's hard. I just forget them. It's
I
annoying.
can.
Like I don't. Yeah, so you just gotta know that the gross motor lift head by 2,
Mm-hmm.
by 4 years sit with the trunk support, by six
Mm-hmm.
months sit
Sit
momentarily,
unassisted. Mm-hmm.
yeah, on a propped hand, nine
Mm-hmm.
month pulse to stand, 12 months stand walks first step. That's the
Mm-hmm.
gross motor. Fine motor at 2 months, hands unfisted, 4 months hands mostly open, reaches
Mm-hmm.
midline. 6 months transfer object hand to hand. Okay. 9 month three finger pincer grasp, holds bottle or a cup. 12 months
Mm-hmm.
two finger pincer grasp. Language like 2 months alert to voice sound cues. 4 month
Mm-hmm.
laugh turn to voice.
Mm-hmm.
6 month respond to name bubbles. 9 months say dada mama. 12 months say first word. Social
Mm-hmm.
at 2 months they have social smile, recognize parents. 4 months enjoy looking around. 6 months stranger and anxiety. 9 month wave bye, play pat a cake. 12 months separation and anxiety and comes when called. That is the idea for this. 200 words. What month?
200 watts.
Mm. That's 24 month. They can talk.
Is it 200 months or two watts?
Mm.
It's 2 watts for 2 years.
Yeah, 2 words, combining 2 words, and
I'm like
200.
200.
Yeah, yeah, and they have 200 words vocabulary.
Oh wow.
Yeah, they
Oh,
combine.
vocabulary. Okay, vocabulary.
Yeah,
Okay.
vocabulary. So now, 1 year old girl with MCV of 70. She drinks a lot of milk. What is that?
Mm. Iron deficiency.
Yeah, so they have what the risk factors is lead exposure, prematurity,
Mm-hmm.
and infant who consume Low iron formula, cow's
Mm-hmm.
milk, soy milk, goat milk before age 1 year.
Mm-hmm.
Exclusive of breastfeeding after age 6 months.
Mm-hmm.
Toddler who consume more than 24 ounces a day of milk and less than 3 serving a day of iron-rich food, meat and fortified cereal. Universal screening CBC in all children age 9 to 12 months. Treatment, we do empiric trial of iron supplementation. Okay?
Mm-hmm.
Now, if you're a 16-year-old boy and you report that your right knee, right ankle have swollen several times before,
Mm-hmm.
yeah, it's very tough. I feel bad for these kids.
Mm-hmm.
Easy bruising, bleeding
Mm-hmm.
after tooth extraction. What is that?
Hemophilia.
Yeah.
He-
It causes
And the
hemosiderin deposition and fibrosis. It's X-linked
mm-hmm.
recessive.
Mm-hmm.
It's
They
causes,
do well if you give them their, the factor 8 and factor 9.
yeah, yeah, you're right, yes. Or you give them desmopressin for mild hemophilia A.
Mm-hmm.
Okay, but you can give them factor 8 and 9 if they're severe. Now, if you're a 14-year-old African American girl with low-grade fever and severe right-sided thigh pain, okay,
Severe right-sided eye pain.
thigh pain that happen
Oh, thigh. Okay, sure.
every summer, happen every summer.
Mm-hmm.
So what's your diagnosis?
Sickle cell
What
disease.
do you see on the peripheral blood smear?
Sickled red blood cells.
Yeah, and whole jolly buddies.
Jelly bodies. Yeah. Mm-hmm. Asplenia.
Yeah, they have acute vaso-occlusive crisis. It's soma recessive, most
Mm-hmm.
common in African American and Hispanic. Okay. Ouch.
Huh?
Yeah. So you
Okay.
do the maintenance, you do vaccine, penicillin till age 5, hydroxyurea, acute pain crisis, hydration, analgesia, and transfusion. That's how you treat it. If you find on peripheral blood smear red blood cells with single round blue inclusion, what is that? What do we call that?
Red blood cell single round inclusion.
Yeah, blue inclusion. That's the description of whole jolly buddies,
Okay.
which is due to splenectomy. Because
Mm-hmm.
spleen usually takes these bodies out, but if it's no spleen, then no one will take. No one
Mm-hmm.
will clean the RBC. So you see, just like our mom, if she's not here, nobody will clean. Yeah. So now, if you're a 10-year-old with sickle cell, presented with
Mm-hmm.
multiple pain crisis and
Mm-hmm.
pneumonia, so how does hydroxyurea help you?
It increases the hemoglobin F.
Yeah,
Mm-hmm.
it increases what the F hemoglobin,
Mm-hmm.
fetal hemoglobin.
Mm-hmm.
5-day-old boy with easy bruising and
Vi-
periumbilical bleeding.
Vitamin K deficiency.
Wow, how do you know?
Because I know. I'm kidding.
Wow, good job. You're like the genie in Aladdin movie. Have you watched Aladdin movie? There's a new one.
No, I don't watch movies.
Really? You know?
I
Yes.
don't have time.
Yeah, yeah, I know. I don't have time to.
Mhm.
Yeah, yeah. So it's like a genie who knows everything. Yeah, it's a vitamin K. Good job. Yeah, I can make it easier by giving you the PT and PTT,
Mhm.
where both increased. Okay, that means vitamin K deficiency. Hmm. Now, if your Peripheral smear shows anisocytosis,
Mm-hmm.
spherocyte with polychromatophilia. Okay?
Mm-hmm.
And you have jaundice right now, hemoglobin low. What's your diagnosis here?
Hmm.
So it gave
Is
it
it
away by telling you spherocyte on peripheral blood smear.
spherocytes?
Yeah.
Okay.
So it's
So if
hereditary.
there's
Hereditary spherocytosis. So we gotta
mm-hmm.
do acidified glyceryl lysis test.
Mm-hmm.
That's how you know. So how do we treat that?
So how do you treat that hereditary spherocytosis? Folic acid supplementation, and
Yeah, and splenectomy, folic acid
yeah,
transfusion, so
if
splenectomy.
they're symptomatic, yeah.
Yeah. When do we use eosine 5 meliamine
Mm-hmm.
binding test?
When?
Yeah. That's for
Uh,
spherocytosis.
yeah, it is.
Yeah. It's autosomal dominant. That's the bad thing about it.
Mm.
That's the messed up part about it.
Why is it why is it bad if it's autosomal dominant?
Yeah, because it's horrible. Like if anyone have it, can transfer it to all his kids.
Oh, okay.
Yeah, but if it was recessive, then it's gonna be only you gonna be affected. So if you marry someone else who doesn't have it, your kids won't have it.
Mm-hmm. It will be a carrier.
No, you'll be carrier, but that's not a problem because
Mm-hmm.
it's a skeletal. Like it's a very interesting. I remember that we had the mechanism of how's that happening. It's very interesting.
Mm-hmm.
Yeah, it's very interesting, like physiology stuff. Okay, now if you're a 6 hour old boy, imagine if you're a 6 hour old.
Mm-hmm.
Hemoglobin, okay, hemoglobin is 22.
Mm-hmm.
Okay, hematocrit is 69%.
Mm-hmm.
What's going on here?
You are so funny.
Uh,
So this is polycythemia.
yeah, whenever hematocrit more than
Mhm.
65% in term
Mhm.
infant, that's a
Of
polycythemia.
newborn. Mm-hmm.
Yeah, causes could be increased erythropoietin from intrauterine hypoxia,
Mm-hmm.
like diabetes, hypertension, smoking, intrauterine growth restriction, or it could be erythrocyte transfusion, like twin-to-twin transfusion, delayed cord clamping. Clinical manifestation, they have ruddy skin, hypoglycemia, respiratory distress, cyanosis, apnea, irritability, jitteriness, abdominal distension. Treatment, plasma exchange, remove of blood, infuse normal saline. And that is it. Now, scaly patches, recurrent otitis media, and platelet of 24,000.
Oh, Wiskott Aldrich syndrome?
Yeah, how do you treat that?
I don't know.
Stem cell transplant.
Okay.
Because it's an X-linked recessive defect in
Mm-hmm.
WAS gene protein, impaired
Mm-hmm.
cytoskeleton,
Mm-hmm.
changes in leukocyte and platelet, that's why.
Okay.
What's most common symptoms of sickle cell trait?
Oh, that something I saw something in the urine.
Hematuria, they're gonna hematuria. Now, if you're a 4-year-old male with fever and headache and nuchal rigidity,
Mm-hmm. Meningitis?
yeah, due to ecovirus because the glucose was normal.
Oh, okay.
Now, if you have injected conjunctiva with pain with movement of the eye, what is diagnosis?
Orbital
Orbital. Pain with movement. Yeah,
cellulitis.
pain
Mm-hmm.
with movement is the one that differentiates orbital from periorbital.
Mm-hmm.
Preceptal, I mean. Septal.
Yeah, preceptor.
Yeah, so ophthalmoplegia. So I want you to remember four things only.
Mm-hmm.
Because all of them have edema, erythema, tenderness, fever, leukocytosis, both of them. But the
Mm-hmm.
only one specific for orbital cellulitis is ophthalmoplegia, pain with
Mm-hmm.
extraocular movement,
Mm-hmm.
proptosis, and vision impairment. Those are only
Proctors.
in orbital cellulitis but not in preceptal.
Mm-hmm.
If you're an 8-year-old boy with honey colored crust, how do I treat you?
Impetigo.
Yeah, it can be complicated to post streptococcal glomerulonephritis.
Mm-hmm.
You give them topical mupirocin, topical antibiotic.
Yep.
Most common staph aureus, group A strep. Presentation with a painful, non-itchy pustule and honey-crusted lesion. Now, if you're a 6-year-old boy who refused to walk and your right
Mm-hmm.
hip externally rotated and scream with any movement involving right hip,
Mm-hmm.
what is diagnosis? Or what's how do you treat?
It might be osteomyelitis.
So
But
this
if they have
screaming with any movement of the right hip, that's most
uh
likely septic arthritis.
septic.
Yeah, so you do
Okay.
surgical drainage of the hip.
Mm.
Okay. White BC count 35,000 and stuff. So if you're a 6-month old boy with watery continuous diarrhea and oral thrush with generalized lymphadenopathy, what's your diagnosis?
6 months.
Hmm?
Oral thrush.
Yeah.
HIV.
Yeah, good job, Jay. Poor kid, yeah.
I know.
Drooling, dysphagia, difficulty swallowing, that's an epiglottitis. You know that, I know for sure. Now, if you're a 2-year-old boy with difficulty breathing and you have cough that sounds like barking dog,
Mm-hmm.
blood pressure 90 over 60, pulse rate is 104.
Mm-hmm.
Okay, so how do you treat this laryngotracheobronchitis?
I think they have treatment for mild and severe. If it's mild, you can
Mm.
do the what do you call it? The aerosolized whatever with dexamethasone. But if it's severe, then you can do that what do you call it? The humidify air plus. Give them what do you call it? And epinephrine, aerosolized epinephrine.
Yeah, racemic, good job.
Racemic, yeah.
Yeah, if you are an 8-year-old boy with a 92 over 85, 48 blood pressure, temperature of 104, you cry in any attempt made to flex your head. So how can I treat you? Or what's the best
Mm.
next step?
So likely this patient has a meningitis.
Yeah, so we do lumbar puncture and
Mm-hmm.
then IV antibiotics. What
Mm-hmm.
antibiotics?
So how old again?
8 months.
8 months. So you can do, I think, Vanc and ceftriaxone.
Yeah, or cefotaxime too, and dexamethasone for Haemophilus type B
Mm-hmm.
meningitis. So, what are the indications for imaging before lumbar puncture?
That will be if they have like a focal neurological deficit. If they have what do you call it? Like ICP, if they have any type of a focal neurological signs, you have to do CT before you tap.
Yeah, focal neurologic deficit, head trauma, hydrocephalus, or a neurosurgical procedure. We do that. Okay, and then they can have fever, seizure, altered mental status, Kernick-Brody, and bulging anterior fontanelle too. Okay,
Okay.
if you're an 18-month-old child with fever, vomiting, lethargy,
So for the question for the children, do you all do the CT before you tap for meningitis for the kids?
yeah, if you have focal neurologic deficit or hydrocephalus, yeah.
Hmm. Okay.
Yeah, you do CT because you don't want to,
For both kids and adults.
yeah, you don't want to cause a herniation and you lose your license. All this
Mhm.
you're
But
Somali
for
working.
papilla edema, you don't have to, right? You
Huh?
can just for pseudotumor cerebri, you don't have to do CT before you do the lumbar puncture, right? I
Yeah,
think,
yeah, but you don't need lumbar puncture much in tumor cerebral. Yeah,
yeah,
mostly.
if you're
Yeah, only
doing
two.
it to help with the symptoms like, oh well, yeah, let's keep going.
Yeah, yeah, you're right. Yeah. If you have rash and meningitis, what is that?
Like severe meningitis.
Yeah, that's a nice. Yeah, that's a unique purpuric rash.
Mhm.
Particular purpuric rash. So make sure you know that.
Oh man.
Yeah. Now, if you're an 8-year-old boy who
Mm-hmm.
brought to the office for shortness of breath and I found gram-positive cocci in clusters.
Mm-hmm.
So what bacteria is that? This is gram Staph aureus, obviously.
Yeah, Staph Harris.
So the common cause cystic fibrosis related pneumonia. It could be
Mm-hmm.
gram-negative rod like Pseudomonas, Burkholderia, and those types of bugs. And gram-negative rod, gram-negative coccobacilli like non-typable Haemophilus influenza. Gram-positive cocci in chain, strep pneumonia. Gram-positive cocci in cluster, staph. So this is how you know that. Now, if you're a 9-year-old girl with continuous with subcutaneous nodules and pericardial friction rub, ST elevation, and
Pericardia,
uh,
hold on.
continuous
Pericardia friction.
jerking of arms and hands. So
Pericardia
hand and arm jerking and pericardial friction rub. Yeah.
arms and legs jerking. So like seizure, pericardial friction rub, and what else?
Subcutaneous nodule, ST
Subcutaneous.
elevation,
ST
s-
elevation.
sore throat. Yeah.
Huh.
This is rheumatic fever, acute rheumatic fever. Hmm?
Mm,
Yeah,
okay,
makes
yeah.
sense, right? Subcutaneous.
Mm-hmm.
So
Yeah, makes
yeah,
sense.
so we have
Pericarditis. Okay.
major criteria and minor. Major Jones,
Mm-hmm.
which is J for joint migratory arthritis,
Mm-hmm.
O for heart, look like a,
Mm-hmm.
and nodules, subcutaneous that I told you about.
Mm-hmm.
Erythema marginatum, Sydenham chorea, jerking movement.
Mm-hmm. Mm-hmm.
Minor
Mm-hmm.
fever, arthralgia, ESR, C-reactive protein, prong PR. Late sequelae, mitral rigor stenosis, prevented with penicillin for group A strip.
Mm-hmm.
Now, yeah, diplopia is a sign of orbital we talked about that. Now, if you're a 11-year-old boy with uh, irritating dry cough and you have nasal congestion and subconjunctival hemorrhage. Okay, so what's next step in management?
Subconjunctival hemorrhage,
Mm.
cough. It looks like viral. Subconjunctival hemorrhage.
Yeah, so this from
Yeah, is
coughing.
that adenovirus? I don't know.
So this patient vomit because of the coughing.
Oh, what do you call Bordetella pertussis?
Excellent. Yeah, so we do pertussis polymerase chain reaction testing.
Mm-hmm. Mhm.
So pertussis in infant and children, there are three stages: catarrh, one, and paroxysmal and convalescent. The first one is only mild cough. Second one, 2 weeks to 6 weeks, present with coughing, paroxysm, inspiratory, whoop, post-tussive emesis, apnea, cyanosis. And weeks to months, the convalescent, symptom resolve gradually. How do you
Mhm.
diagnose it? Put pertussis culture or polymerase chain reaction and lymphocyte predominant leukocytosis. That's it. Treatment:
Mhm.
azithromycin, erythromycin, clarithromycin, macrolide.
Mhm.
Prevention with acellular pertussis vaccine. Complication can cause pneumonia, weight loss, subconjunctival hemorrhage like this patient, pneumothorax, respiratory failure, and death in infants. So that's about it. This patient. Okay, now let's do a really rapid review of what we discussed for now. Wow,
Okay.
we did a lot. That's good.
Mhm.
We talked that SCID cause low CD19 and CD3. CGD cause recurrent abscess. Stem cell transplant for Wiskott-Aldrich syndrome and SCID. Coarctation of aorta have hypoxia and lower extremities. Holosystolic murmur and VSD. Injected conjunctiva and mouth, that's Kawasaki. Knee chest position improved tetralogy of Fallot. Truncus arteriosus and no thymus, that's a hypocalcemia. Continuous murmur PDA. HOCM is one of the causes of sudden cardiac death, like long QT. Linear arrangement below the knee, this is contact dermatitis, type 4. Irregular menstruation after menarche, that's an immaturity of the thing, of hypothalamic axis. Right ovarian mass with precocious puberty, that's a granulosa, not central. But if you have high LHFSH, that's a central. High estrogen therapy for abnormal uterine bleeding. Gonadectomy for androgen sensitivity syndrome, cryptorchid gonadism. Niacin for the 3D. Niacin is the 3D diagnosis. Breastfeeding decreases risk of breast and ovarian cancer. Picked with Wedmian syndrome, we gotta do ultrasound and alpha fetoprotein for hepatoblastoma. Mickle, we treat with surgery. Can't see in darkness, that's a vitamin A deficiency. Mm. Okay. Iron deficiency anemia, we treated with giving lead. No, I'm joking. Iron, we give him
Giving lead.
iron. And so acute pain crisis, we treated of sickle cell increase. We give hydration. Blue inclusion on RBC, that's a whole jolly buddies. Hydroxyurea increase fetal hemoglobin. Vitamin K cause PT and PTT prolongation, both. That's a very unique specific. Glycerolysis test for spherocytosis. Plasma exchange for thrombopolycythemia. Found a better thing. Thalmoplegia and orbital cellulitis. Impetigo, we treat with imupirocin. Surgical drainage for septic arthritis. Epiglottitis cause 3D. Racemic epinephrine for the laryngotracheobronchitis. Neisseria meningitidis cause meningitis and petechial rash. Sickle cell cystic fibrosis can be infected with pseudomonas and stuff, and gram-negative bacilli. Acute rheumatic fever can cause mitral regurg or stenosis. Okay, post pertussis we treated with azithromycin. And that is it for this hour. So let's take a break for 10 minutes and then we'll continue the next, okay?